Hello, my friends. Lori Ashcroft here. I'm your host for Viva La Evolution, which is a training and consulting branch of Westwood Behavior. And if this is your first time visiting us today, let me just give you a quick description of what we're all about here at Viva La Evolution. We wanted to create a space where we could pull together a conversation of a lot of different people from different points of view and look at what's really working in the system. And then to also have the courage to look at what's not working. And then together find ways to improve the services that we're offering. The common ground we all have is that we want to be the best we possibly can and provide the best services we can. So that's what's pulling us together. So far, we've talked to, 35 or so people. If we got them all in a room, they wouldn't agree with each other on some things, but we would all agree on wanting things to get better and doing our best to do them. So thank you for joining us and becoming part of that conversation. And if you don't mind, please push the subscribe button. That will help us out. So, okay, today's going to be a very interesting talk. We're meeting with Florian Birkmayer, who is a recovered psychiatrist. And I'm calling him that because, you'll see his amazing story about being trained as a psychiatrist, doing that work, experiencing the shortcomings of it, and finding ways to continue to contribute in ways that are extremely meaningful and helpful to the rest of us. So here we go. Florian Birkmayer. Okay, so Florian, thank you so much for taking time to join us. I've just been so excited about sharing you with our viewers. I came to know about you by reading your article entitled Unbecoming. And the thing that really spoke to me in that article was your comments about wounded healers, and then asking the question, are we a wounded healer or are we a wounded wounder? Because I think so much of what we do in the mental health field, unwittingly and certainly unintentionally, is we accidentally keep people from recovering sometimes, or we keep them from becoming resilient because we're doing to them what we were trained to do. So I'm just excited about you sharing some of your thoughts and findings around that paper. And I don't even know where to tell you where to start. So maybe let's start with you. Like, you had an interesting journey of why you became a psychiatrist and why you stopped being a psychiatrist.
Yeah. Well, first of all, thank you for having me, because I'm really grateful for this opportunity. And just in getting to know you, I think we're very similar in our outlooks, and that's, we all need to inspire and support each other. And the quote, which I think might be good for the first part, is, and I swear I read it in Jung, it's, if the wounded healer doesn't deal with their own wounds, they become the wounded wounder. And let me just talk about that a little bit, and then about my own path. But to me, that means not just when something really horrible goes wrong, like the surgeon who flips out and, I don't know, does something in the OR that people are like, oh, that's not right. Or you could even, there's other examples, but even when other examples of healers being inappropriate in some way. But what really struck me about that quote is, even when we do things exactly as we're supposed to, we can still be wounded wounders, because, as you just said, when we perpetuate the system, which has a power differential, there's the psychiatrists, doctors, therapists, and the client, that's intrinsic to the system. So even if you're doing things exactly as you're trained to do, you're perpetuating that. And that's really what struck me. I had a private practice in which I wanted to be holistic. And then I read this book by Edward Whitman, who was both a Jungian and a homeopath, which is already sort of a strange animal. What
Yes.
I've learned is that he was really like lost between the worlds. And I think that's cheers to all of us who are between the worlds. Like if you think of a bridge, you know, a bridge is always between two places. And that's really what we need. We need less people in silos. But that's what happened is I read this book and it was like holding up a mirror to myself. And the gist of the book is like, if again, is that quote. And I realized that there's another quote that's related to it where he said, you know, if the healer doesn't acknowledge their own most wounded and unworthy part in themselves, the part that they think isn't worthy of healing, then they unconsciously keep the client trapped in the client role. So whether you're holistic or, you know, I don't want to get sidetracked, but, you know, those people say, I'm a biological psychiatrist, which again is a pretense where there's like, oh, I'm going to pretend that all these unconscious things don't matter. But again, that power differential is there, even if you're saying, oh, I'm holistic.
Yeah.
And that's what really struck me, saying, I am unconsciously perpetuating this system and I need to stop because I don't know how to continue in this work. And that includes even diagnosis. You know, on the one hand, diagnosis is used in a very restrictive way. It's like you put someone in a box, put a label on it, and seal the lid. There isn't really, you know, psychiatric diagnoses are very sticky. They never really go away. No one ever says, yep, you're cured from that. The flip side of that is that sometimes diagnoses can be really helpful to people, but I think that's part of that seduction. It's like, you know, what can we take that's helpful without being put under the spell? You know, it's like when you give someone a diagnosis, it's like you cast a spell on them and they can't say, you know what, this is my journey as a human being. I mean, there are now, of course, people who are disagreeing to that, and then whether it's medication or psychotherapy, the whole thing is, you know, even the symbolism of the white coat is, you know, I'm the expert, I know these things, and you are the, you know, the word. I don't like the word patient because it implies that they're patiently receiving, and what it is about for me is really each of us being on our human journey and not pretending like I have some superior knowledge. So the biggest part of being a wounded healer is saying, I got to look at myself, because if I don't, I'm going to unconsciously ask the client to carry it. No matter how good I try to be, how holistic I try to be, the entire system and the cultural expectations around the systems create this power differential.
Absolutely. You know, I don't know what you think about this, but we have struggled with that for the last 30 years in our work. And just not liking that part and seeing that power differential as something that automatically begins to rob the person of their own strength. And so, you know, there's a lot written on strength approaches and strength-based therapies, which I think is really helpful. But so there's that. But what we came to realize is the antidote to that power differential is relationship. So if I'm a psychiatrist and I approach you as the person with absolute respect, realizing that I have some knowledge, but you have a whole bunch of knowledge about yourself. And you're different from everybody else I've seen. I can't just slap a diagnosis on you and as you say, close the lid and then treat you accordingly, like some kind of a rhythm that we get into. So what do you think about relationship? How does that impact this power differential?
I think that's really the key. Let me backtrack a little bit, but you know, you said it's disempowering and dehumanizing both to the client, but also to the provider, because again, the provider is trapped in their role and in a way having to have the answers, having to be the expert, doesn't allow to say, you know, I don't know, how can I grow? And not just what else can I learn, what other training can I, but really, where am I in my process? So I think that the system dehumanizes everybody. And that's really haunting. And I think for clients, the dehumanization and the deep disempowerment, it's more obvious. So there's more sort of like, I'm not going to subject myself to this. The problem on the provider side is it's very seductive. You have power, salary, role, title, but it's just as dehumanizing. And I think relatedness, relationship is key. Years ago, I was very fortunate through my, I did residency training at the University of New Mexico in Albuquerque, and they had a program in rural psychiatry. And through that, because of this interest, I worked with a Navajo tradition-based detox and rehab center in Gallup, New Mexico. And one of the aspects of that program was they called everybody relative. And that's not just some hippy-dippy term. That's actually based on the clanship system, where everybody actually is a relative. And the clanship system actually has a sort of openness to non-tribal members, so that when someone says my relative, it's not just a term that has no meaning. It has deep meaning. And that relatedness is really key. And I think that's really beautiful and important. And it's and it makes us more vulnerable, but it also makes us more human. It makes us more whole. And I would say relatedness isn't just, obviously in the immediate setting, psychiatric behavioral health system with the providers and the clients, but it really should be to the whole world, to the animals, to the plants, to nature, to social groups. I think a lot of that in-group, out-group, that division, that's in a way why we're in the climate crisis, is because we've viewed the earth as this inert thing and not realizing we're in deep relationship. The air we breathe, the oxygen is made by the plants. No one pays attention to that. I think we would treat the world very differently if we realized we're in deep relationship with it. We would treat other people, instead of labeling people in this dehumanizing way, which happens all over. We would treat people, if we're related, if I'm another you, which is another way of saying that, I think a lot of the really traumatizing and dehumanizing conflict that's happening in the world. Sorry, I'm getting kind of broad, but I think the dehumanization that happens in the behavioral health system is a microcosm of what's happening in the whole world.
I think so too. I agree. So what I'm hearing you say too, implicitly, is not only is relationship key to overcoming the model that we work in, but it goes much deeper than that into forming community. And community is what supports all of us. I mean, we can't really count on one therapist to support us throughout our life. We have to have community. And so I love what you're saying in that regard. And the other thing you're making me think of was your comments about the earth. It seems like we have had a mind to use the earth like we would use another person inappropriately. And we see it as it's there to serve us. And we don't see ourselves as stewards of the earth. And consequently, we're using it up. We're damaging it. And I think, that's maybe the big picture of what happens to the people we serve is it's the lack of respect, I think. It goes with that hierarchical power differential to some extent.
Well, what you've made me think about is there's actually probably two forms of relationship. There's sort of the unconscious automatic programmed and the choice. And the unconscious automatic programmed, there's several layers of, like I used to joke that by going through a psychiatric residency program, we become who we become almost by osmosis, which is a joke, but it's like there's this cohort effect. My peers are acting like this. And I think the same would happen for different roles in the behavioral health system. And I think, and that's sort of one of those unconscious relationships that we don't question, and yet they fundamentally shape us. In my own life, my grandfather was a doctor, my father was a doctor, and in a way that I'm only beginning to decipher and appreciate, I think they put these rails on my life very early on. You know, the feeling I had when I applied to medical school, you know, I was sort of, well, it's my choice, but there was no alternative in my if I have to sort of think back to that, I just never felt there was an alternative, and that I think was the program inherited. And again, that program also includes, well, we're special, we're a special family, you're different. It feeds into, you know, this whole social structure and elitism. So I think there's all sorts of ways in which we're unconsciously programmed into relationships, and those are the ones that aren't, let's say, healthy. They're not mutualistic.
Yeah.
They are, you know, then if you're, you know, if you get raised or through your cohort learning think, well, I'm special, then someone else isn't special. That, and I think that happens on many levels. You know, I remember going to, you know, it's hard to talk about even though it was so many years ago, but in the training there was always like, you know, well, we're not nurses. And then I remember going to nurses meetings and they would tell jokes about doctors. So there was sort of the group cohesion was sort of dependent on telling jokes about the other group. And I was like, there's something wrong with that picture. And again, in a way, you know, it's the old, if you're a hammer, everything looks like a nail. In a way, in order for that professional role to be justified, the client has to be in the client role. I mean, one thing that you made me think of, and I can't, this is probably the best place to mention it, what we're treating is based on the models we have and the medications we have. I remember several clients telling me years ago, don't take away my voices, they're my only friends. And yet the medications, the antipsychotic medications, that's what they do, but that's not what the client wants help with.
Yeah.
But to us thinking, well, this is what we should treat, there's a disconnect there. It's more like, I've got the tools, I'm going to use the tool. When you're a hammer, everything looks like a nail. I'm going to use that hammer and find all the nails, instead of saying, well, what is your journey? What is my journey, really? So I think that's another aspect of this relatedness is that mutuality, that respect, that really seeing the other person as a whole human being on their journey. And I think diagnosis can be against that. You know, it's like when you diagnose someone or give someone a diagnosis, it's, again, you're putting them in a box. It's like you're casting a spell on them instead of saying, you're a human being, you're having unique experiences on your journey. How can I honor those? And how can I actually be honest about the unique experiences in my journey that I may be unconsciously asking someone else to carry, my client or whoever.
You know, we've done a lot of work in developing what's called peer support specialists. So these are folks who have had, in most cases, pretty serious bouts of mental illness. And I know most of the folks we've trained have been on Social Security for mental illness. And it's hard to get on Social Security for mental illness. So it's, you know, if you get that, then that's like the stamp of approval. You are hereby designated an official mental patient. But we've taken folks like that who want to, we don't make anybody do it, who and train them in an 80-hour training, and then there's an internship to work alongside people. And their best tool, their most effective tool, is their own story of recovery. And I mean, that's the leveler, you know, and that's the connector. And we have had amazing results with that. And I hadn't thought to frame it the way you are, but it fits right in there of the helping person sharing their story right along with the other person, walking alongside, not above, and just being there. And you can share resources or share ideas about things, but it's not hierarchical. A big emphasis on mutuality. And that's kind of fits in with what you're saying. You know, I wanted to talk with you more about something that I see so frequently, not just in the moment, but throughout my career. Is, I don't know what to call it other than Well, to myself, I sometimes call it autopilot. I sometimes call it drift toward convenience. Um, but the way I see it play out is people are excited about becoming a helper, working in the helping field. Um, for some good reasons and maybe some not so good reasons, like I mean, maybe their own need to have some control over other people. I don't see that in a real profound way. It may be there. Mostly I see people who genuinely want to be helpers. And then they get into the field, um, especially if they work in the facility, but not, I mean, I see people in private practice doing this too. And then they kind of get worn down and they start doing what's easy. And and that means kind of going through the motions. It's kind of an occupational hazard because it's the way they think they are they they might call this boundaries. They think they are um, protecting themselves so they can continue to serve. But what they're doing is compromising their effectiveness by serving, because as you would say, I think they haven't done their own personal work. They haven't drawn the energy and the wisdom from the shadow side. And you and I have talked about that Marianne Williamson quote that Nelson Mandela made famous. Yeah, that speaks to it in a way, wouldn't you say? Like we're afraid of our strength sometimes. And I mean, I've seen people go for years in that semi-comatose state. Yeah. And
Yeah.
I've probably
I
done
mean,
it myself from time to time, fallen into it briefly.
yeah, I mean, you mentioned many important topics, so I hope I can touch on them all. Let's start with the quote. I think it's, you know, the poem is called Our Greatest Fear, and I think I may be even getting that wrong. But one of the lines is, our greatest fear isn't that we're weak. Our greatest fear is that we're powerful beyond measure.
Yeah.
And so you mentioned the shadow and this sort of autopilot. And I think what happens in autopilot, I think there's two dimensions to it. One is that the brain has a natural network that makes autopilot very easy, you know, and the obvious example is if we're driving to work or to a store that we've been 100 times to get there and you don't even remember the drive. So there's sort of a brain proclivity, let's say. And then I think there's also a cultural proclivity. Like when we start working with our peers, we talked about relatedness. And again, I think the peer sort of, the people we work with have an influence on us also in terms of, don't stick your head out too much. I mean, I'm misparaphrasing that now, but I think that there is a cohort effect into becoming maybe less open, maybe becoming less human. The example I think of is when people say I'm a biological psychiatrist, that's sort of this label to pretend that all the interpersonal factors, that all the unconscious factors, that their own shadow issues don't matter. You can't just invoke that word. That's just one example, but I think we learn. So there's that natural proclivity to go onto autopilot. And the interesting thing is, I think that, one term you and I have used is the cognitive ruts, but I really think it's almost that tendency to fall into the habit is really the ego. It's really the story we tell ourselves of ourselves. And those same ruts have been shown to be involved in common psychiatric illnesses. Again, we've questioned the whole concept, but there's, those ruts are not always healthy, let's say. I think they can make us blind. They do make us blind.
Very blind. Yeah. You and I've talked about those little videos. Sometimes it's a dancing gorilla, sometimes it's a dancing bear, where there's two teams playing and you're paying attention to the teams and you don't even see this amazing thing that's happening. And I think when we get in those ruts that you're talking about, we miss the person's potential. We miss their uniqueness and the special things about them that they could draw on to really pull themselves together.
Yes. I think that we do that to each other and we do it to ourselves, which goes back to the Marion Williamson quote, our greatest fear is that we're powerful beyond measure. There's something when we're blind, when we're in that rut, where I think we don't give ourselves and others full credit for what we're capable of. And I think that's so and that's in a way one of the reasons to do this work, because being in that rut is limiting ourselves and others. And that's why the shadow work, saying, well, what unconscious biases do I have in this? How is my work, how has my outlook been shaped in ways that I wasn't even conscious of? How am I looking at this other person in a way that I'm not fully conscious of and sending them the message that they're limited in some way? So
Yeah.
it's all these layers where, and again, if we say, hey, I can look at myself, not through any grandstanding or telling anybody, but when we look at ourselves, it does ripple out in our being. And I'll give you one example. Years ago in training, we were encouraged or required to have long-term psychotherapy patients. And I had this one client, and I thought we did good work, and he was very hard on himself, always judging himself greatly. And at the end, when we had to wrap up, I said, okay, what was the greatest experience you had from me? And I thought he'd give me some episode where I gave him a brilliant interpretation. And what he said is, one day you were running late and you came to the waiting room and your shirt wasn't tucked in. And I thought to myself, well, if he's so passionate, so in his element that he doesn't even care that his shirt's not tucked in, that means I'm okay too. So something I couldn't take any credit for, that I was completely unconscious, was the most healing gift to the client. And that stayed with me for many, many years, because that's really, that's the essence of it. The things we do unconsciously or work hard to try and make more conscious touch our clients both in positive and negative ways.
Yeah. Reminding me of, I love that story, by the way. And I would just add to it that one of the things that made that story that moment so special, may have had something to do with your shirt, but it may have also had something to do with the fact that you respected the person enough to come out and say, I'm running late. I mean, how many times have we all sat in doctor's offices for 30, 45 minutes and nobody says boo to us? I mean, our life isn't important, but their time is, you know what I mean? So the fact that you did that contributed, I think, to the untucked shirt too.
Well, and again, even what you just said is there's this expectation. We're already in this ruts. Oh, if I'm going to go to a doctor's visit, there's a good chance I'll be late. And then by the time you see the doctor, they're often so stressed, they're behind, that it's like you don't almost, I mean, as a when I see my primary, I've had that same, like, oh, I better not talk about everything that's on my mind because I can tell how busy they are. So the whole system is inhuman.
Yeah.
That's and the inhumanity is not given. People will say that's just the way it is, but that's again the blinders. That's again, there's this phrase, there is no alternative. I mean, I realized that my upbringing, I was programmed to think there is no alternative to going to medical school, but I think so much of the way things are done, the way systems are organized, the implicit message is there is no alternative. And that's dehumanizing to everyone. And that I guess that's part of my work, is if we each work on ourselves, then there is an alternative. Then we can all encourage each other in each other's humanity instead of saying there's no alternative.
You're making me think of an experience I had. Oh gosh, this is probably 30 years ago. No, well, yeah, at least 30 years ago. And I was director of a huge case management system. And we were getting in trouble because the case managers were putting too many people in the hospital. I thought they were too, but there was a housing shortage, and you know how that goes. It's just so. So I made this rule. I said, okay, from now on, nobody gets to go in the hospital unless I see them first. And what happened immediately is about 50%. The hospitalizations dropped by 50% because that was just a wake up. It wasn't about me. It was like, oh, I get it.
Mhm.
But then I do remember seeing some of these folks, and this one time especially, I'm sitting across the table from a woman who is in a situation that is affecting other people in such a way that they want to put her in the hospital. And she's bought into this. She believes that she's sick too and that she needs to go into the hospital. So I sit down with her and I say, tell me a little bit about yourself. Help me get to know you. And so she basically told me the story that she's told everybody for probably 20 years. I mean, she was on autopilot telling me the story. They placed me here, and then I did this, and I'm in the hospital. I lost my kids, and I went into substance, and this common story. But basically a story of almost kind of a victim story, but a complicit victim, a cooperative victim, if you will. And I'm listening to her story, and she's telling me what medication she's on. And for many years in my life, I just struggled desperately with depression and anxiety, which then caused other things like eating disorders and a few other things. So at this moment in time, I'm struggling and I'm trying to figure out what to do with systemically, and I'm listening to her. And I say to her, you know what? You and I are very much alike. I'm taking the same medications you are. And she was like, no, you aren't. No, you aren't. And I said, yes, I am. And I know what it's like to have addictions. I know what it's like to not want to get out of. I mean, I didn't want to get out of bed this morning. Well, I'm telling the truth too. I'm not just trying to tell her a story. And what stuck with me is how she didn't want to believe it. She wanted me to be a person who would fix everything. Even though what I had to offer, it hasn't fixed anything so far in her life. We're just recycling the same old treatments. But I think that's such a picture of this system, this hierarchical system. It's an agreement almost, and nobody likes it. I mean, the patients don't. I guess I don't know.
Yeah, no. I mean, first of all, what a touching story, and you humanized yourself and you humanized her, and then it's almost like two actors in a play saying, "Hey, guess what? We're both actors," and the other one is like, "Shut up, just say your role, say your parts." Like she was so acculturated that she in the system that had, like, in a way, the programming in her mind couldn't allow for you to be a human being that's also struggling. And again, where did that programming come from? And it's that programming, I think, is very pernicious all around, in the behavioral health system, in society at large. I'm just really taken with that story because it's maybe it's not the right direction to go, but there's this old vaudeville routine called Niagara, where two guys, whenever one of them says the word Niagara, the other one becomes like this maniac and strangles him. And then the word gets said and the guy catches himself, so he doesn't become the maniac, but the other guy, who's the target of the maniac, goes through the motions acting as if he's getting strangled because he's so much in the role. That's the joke of the vaudeville. It's an old routine, and that's really what we all do. And we become, again, going back to the Marianne Williamson quote, we're afraid of our own power. And I think even afraid of our own power, I think, again, more on the provider side, on people in the system, there's a seduction to the role, to the mask of the role. I don't have to be a real human being. I can have the letters behind my name, my fancy office. but I think there's a greater power in being more authentic,
Oh,
for ourselves and to inspire others.
yeah. Well, just take that the story I told you. Let's pretend what happened next. So let's pretend that she says, well, no, how can you help me if you're like me? And then if I were to say, I'm not here to help you. I'm here to support you in helping yourself. The strength, the solution is inside of you. It's not in anything I do. And then what would she say? She would say, well, I don't have it. I've never found that part of myself. She would be saying, I've never seen my shadow. Um, I got stuck in this drama, this role, and all I know to do is play it out. And I mean, we could go back and forth with me saying, well, you don't have to be there. Come on, step out behind that mask and stop being a patient. Where are we going to go from here now that you're not a patient? Um, it's just an interesting way to think about what might happen if we did things differently.
Absolutely. But again, I think the whole system is stacked against that. I think, as you said, disability, it takes a lot to get on disability, but then it also, then people are afraid to lose it. There's
Yes,
no
yes,
provision in I mean, even the term disability, as someone said years ago, it's like, getting on disability is very disabling because you have to then stay disabled to get the the check. And so that idea of, well, I can pull myself up, I can transform, there's a very strong economic incentive not to do that.
right, right.
And that's that, again, it goes back to the shadow. I mean, sometimes our greatest gift is in our shadow, and people are like, no, I don't have any gifts, I don't have any power. And
Yeah,
it's not just the individual, it's often previous generations. In the same way that previous generations can make us feel special or part of an elite, they can also make us feel very disempowered. And that's, I think, again, that's one of the reasons to take these difficult looks at ourselves. How am I unconsciously perpetuating the system regardless of my role? And I think that's, how are we being sort of in our social structures, in our workplace, with our peers, how are we unconscious in how are we in these ruts that
hmm
we could all benefit from questioning. I think it's very challenging. I think we need to acknowledge that it's not just, oh, you just haven't said, oh, I'm not that person. All these external factors,
yeah,
all
yeah.
of society reinforces that. I think that's why you mentioned Mad in America and Robert Whitaker's work. That's why that's so important. I think in the anatomy of epidemic, there's a chart that the number of people on disability for psychiatric diagnosis has grown over the years, and the number of prescriptions has grown over the years. The parallel is when antibiotics were introduced, tuberculosis, as more antibiotics were prescribed, tuberculosis plummeted. But the fact that both the number of people on disability and the number of prescriptions increases, to me, means we're not really changing the system, because it's not about these medications working. It's really about the fundamental assumptions in the system,
Mhm.
diagnosing people, the medications, again, treating, like when you're a hammer, everything looks like a nail. The medications treat what can be measured in a lab, which can be studied, but it doesn't really make people's lives better. So
Right.
I think the system is very dehumanizing at many different levels.
Well, if we think about, if I think about it like that, I start feeling like there's nothing I can do about it. But if I think about it like just in my like what I have to offer, what as a little human being, um, mm, like one t-shirt at a time, let's say. How
Mhm.
could we change the world one t-shirt at a time?
Yeah.
Um, and so if let's bring it right down to the guts of this. So if I'm working in a facility, whether it's a group home or a board and care home or a nursing home or a hospital even, if I'm a person there and there's this agreement of this is how we do everything, how can I what can I do to start a shift?
Yeah.
Where does that, it has to start within me, doesn't it?
Absolutely. And I think you said something in response to what I just said. Oh, that's so hopeless. What can little me do? And that's one of the spells. I think that, I wrote on my Substack a piece recently, The Shadow of Hopelessness. And I had this intuition that hopelessness, the idea that there's nothing I can do, wasn't actually a, let's say, natural, heartfelt conclusion, but it was actually part of that rut we talked about, a idea or a thought that we, in a way, you could almost say get infected by. And that's true. And
Yeah.
with regards to the climate crisis, apparently the big fossil fuel companies would, through the media, spread the idea that it's hopeless, it's too late. So hopelessness to me is like an infection. And the other thing with this approach was doing the shadow work, regardless of how overwhelming the outside world is, what can little me do about the environment? What could little me do about all the wars in the world? We can always work on ourselves. We can always look at what's my shadow. And on a practical level, let's see. I mean, I think one thing is when you're working with a client, and even that word is, ask them their name, use their name, ask them, what do you like to be called? I think the dehumanization happens on so many levels. Ask them, tell me something about yourself, and then reflect that back to them. And I personally think that in the same way you mentioned about self-disclosure, saying, oh, I can relate to that because I'm on the same medications. There's this whole extensive discussion about self-disclosure. You don't want to burden the other people, but to level saying, I'm another you. I whatever self-disclosure.
Well, it
I,
seems like the self-disclosure, yeah, I know we don't want to burden people or to take what little, I mean, because they are have a little hope in us, maybe they're at least hoping we'll fix something. So, so maybe the approach there, and this is what we teach peers to do, is say, I mean, the idea is if I can do it, you can do it.
exactly.
So I'm not just telling you this story because I want you to feel sorry for me. I'm telling you the story to give you hope. It's the
Exactly.
intention. Yeah.
Yeah. I think, again, in that very unintended way, like what I talked about with my client, my shirt wasn't tucked in, and that gave him hope. I think when we look at ourselves, when we commit to working on ourselves, when we look at, well, how did I unconsciously, in wanting to be the best, perpetuate the system? Just that act of stepping back, looking at the ruts, that act in itself, I think, ripples out in the same way that my shirt wasn't tucked in,
Yeah.
to someone else saying, if he can work on himself, I can work on myself. Because
Yes.
we're all in progress, and
Yes.
we're
Yes.
all wounded healers. Wounded healer isn't the exclusive terrain or training. The only difference is some of us are unconscious, and then I think the wounded healer can become the wounded wounder, and some of us are maybe a little more conscious and keep scraping away at what else is going on, what else is
Yeah.
putting this rut in me. And that journey is a challenging journey. I jokingly used to say Jesus and the Buddha didn't have easy lives. When we start working on ourselves, it can be quite lonely. It can be quite challenging. And I
Painful.
recently I've told people about, or revisited, Plato's allegory of the cave. That guy who goes outside the cave and sees reality for what it really is, instead of the shadows reflected in the cave. And he comes back inside and he says, "Hey guys, there's the real world out there." Imagine how lonely that must be.
Well, yes. Earlier when we were talking about this, when I was doing the little me thing, I was thinking I got this picture of, you know, uh, of being in an auditorium full of people,
Mhm.
and uh, everyone's sitting down, and maybe I'm in the middle of the auditorium, and I stand up, and so I'm being different than other people, and then I have to. I mean, they either have to carry me out, or I have to give them a good reason why I'm standing up, why I'm being different. Um, so I think that's a key to it too, is being willing to having the courage within your own community, whether it's a facility you work in or a, I don't know, a club you belong to, having the courage to be different.
Mhm.
And it's not, and then being able to explain it. Because if you're just different, so what? But if you can explain it in a way that inspires other people to look at their shadow or whatever it is we're doing, then we can get some movement going.
Mhm.
So I think
Yeah,
it's, go ahead.
no, I was going to say, I mean, I think that's what it is. It's not so much about being different, but really being honest with ourselves, saying, wow, in what I'm doing, how am I unconsciously following the rut? How I'm in the rut? What is the bigger picture? What unconscious factors are making me act in this way now? And often there's a big surprise there. But you know, one reason you can tell something's been unconscious is because you're surprised, or there's a resistance saying, "Oh, that's not me. That's not what I actually do." And just take a moment and say, "Oh, the fact that I had such a strong reaction to thinking that, or
Yes,
someone else pointing that out to me,
yes,
that emotional intensity is a sign something's going on here." You know, that's sort of
yes,
the
yes.
to say,
There's a,
okay,
go ahead.
well, I was just going to say, you know, instead of saying to the other person, "Oh, that's your problem because you made me
Mhm.
aware of that," saying, "Oh, wow, that really triggered something in me. Let me dig deeper into that."
Yeah. I was going to share, I mean, this idea is so darn old. There's a biblical quote story about it, and I might not get it quite right, but it goes sort of like this. Someone comes to, I think maybe Jesus, and says, well, what about, so and so did this, they did that. What are we going to do? Blah, blah, blah. And Jesus says, take the log out of your own eye before you see the speck in the other person's eye.
Yes.
So gosh, I guess it's just ingrained in human nature. But that can be our clue, can't it? I mean, if
Mhm.
someone pushes our buttons, instead of saying, there's something wrong with you, we could be saying, oh, you're pointing at something within me that needs a little attention.
Yeah. I think being comfortable or having enough awareness that when our buttons are pushed, when we get uncomfortable, when something provokes a strong emotional resistance, having the wherewithal to say, wow, I'm really reacting strongly to that. That means there must be something going on, instead of saying, you know, just
Yeah,
following the emotion. I
yeah,
think that's the beginning of wisdom, saying, wow, that really triggered something in me. What is that triggered that in me?
mm.
I think
That's
that's what we can all inspire each other to do,
that's
you know.
yeah, yeah. And that's I recently did a workshop on boundaries, and I realized that I hate talking about boundaries, and because it's all about usually when you talk usually when people talk about boundaries, they're looking for ways to push other people away from.
Mhm.
And I'm thinking, shouldn't boundaries be a place where we recognize that we need to be closer to each other? There's something between us that needs to be moved away so we can be closer, not further away.
Yeah.
So I developed a whole idea around that. I
I
had a good
think
time
bound.
with it.
Sorry, I'm so excited
Oh,
that I
yeah.
tend to interrupt you. But again, boundaries, again, it's this artificial thing. You know, I think the first time that in thinking of my understanding of the history of behavioral health, boundaries was with Freud, where the idea was, oh, you're supposed to be this blank screen that when your patient comes to analysis, that you don't they don't know anything about you. And I think that's completely mythical. That has been debunked, both in, you know, people thinking about therapy, but even Freud himself, there's stories that after a session he'd invite people for a cup of tea and stuff. So this mythical boundary.
Yeah.
And I mean, the other thing, I think, you know, I went to medical school in New York, I went to residency in New Mexico, and worked in a lot of small communities. In a small community, everybody knows each other.
Yeah.
You know, this, you know, in a way, in a big city, people have to put on the protective bubble, whether you're riding the subway or walking down the street. You can't make eye contact with everyone, or at least that's the understanding, even though obviously people are in a deeply shared experience. But it is an artifact. It's one of those unconscious assumptions that on the one hand, then it creates this ideal, and then it creates all the issues around boundaries, how to maintain boundaries, how to not
Yes.
violate boundaries. But I think that's all based on some very unconscious assumptions, let's say, that I think if we question those, saying, hey, we're all just human beings, and yeah, we may shop in the same supermarket, I may run into you. I think that you know, in a way, boundary is one of those false promises. Oh, now that you're a professional, you have this special protection. No, you don't. You're a human being like everybody else.
Hopefully.
Yeah, hopefully, and don't use boundaries as an excuse not to work on yourself and not to examine when you're being challenged, you're being pushed, to say, oh, that's a boundary violation. No, what is it? What's really going on inside of you, in you as a human being, that may be uncomfortable because you've become too brainwashed or too sucked into the role? And that's what a gift.
Yeah.
What a gift to be challenged, instead of saying, oh, that's a, I mean, yeah, there's a lot of topics related to that, but again, it is an invitation to say, how am I unconsciously perpetuating the power differential?
Yeah. You know, we started off thinking we wanted to talk about the wounded healer versus the wounded wounder. I think we've done pretty good at that. But we haven't talked about, I wanted you to talk a little bit about the work you're doing now with is it essential oils?
Yes.
And how that
So
bypasses some of that blockage?
that's exactly it. I mean, I think it's important to question, in a way, to critique the system, but then we don't want to be stuck in the hopelessness of, well, what can little me do? And for a long time, I've been fascinated by the power of aromas, and have been blessed to work both in coaching work, consulting work, and in teaching with using aromas. And the amazing thing about an aroma is, you know, we're all touched by it. I can't give it to a client or a student and say, oh, you smell that, I'm just going to watch. If the aroma is in the room, we're all touched by it.
Yeah.
And it does bypass the intellect. There's even research to suggest that it disrupts that habitual mode. And the other thing it does is it really brings us into the moment. You know, you can really only smell something, and the act of smelling, or the experience of smelling, forces you to be right here, right now.
Yeah.
And that's why I think aromas are a unique ally. You know, they're really, to me, they're not products. They're really the soul of the plant in the vial, because they ask you to be fully present. They ask you to be fully you. They're going to make you feel emotions. They're going to bring things up out of your unconscious like nothing else. You know, the people talk about other modalities, but a lot of the modalities to me are like recipes. You know, there's sort of a script you follow. And while it's good to have, you know, basic rules, I think the aromas invite us to just be present. And that's why it's unique. You know, it's different than music. It's different than other modalities. So I think aromas, you know, you might think they're a tangent or a gimmick, but they reconnect us with ourselves. They reconnect us with each other. They reconnect us with the non-human world. And what a gift that we can smell them. I mean, why do we have a sense of smell? I think it's, again, our culture. It's interesting because, going back to Freud, in Civilization, it's discontents, he makes this very brief footnote where he says, you know, when our four-legged evolutionary ancestors, and, you know, the closest you can think of now is cats and dogs and horse, you know, anything four-legged uses its sense of smell to find its way in the world. And once we started walking upright, our eyes could see a lot further, and the sense of smell became more invisible. But we're still very much driven by our sense of smell. You know, I can't help myself. I do research, and a lot of the research on the power of smell is actually done by marketing companies, because they want to kind of hack that, figure out how can you use smells to influence people's behaviors. And we all know, you know, that when you smell the donut smell at Dunkin' Donuts and so many other examples. It
Yeah.
changes the mood you're in.
Yes.
But I'd like to do it in a more healing, holistic way, that when we smell in a mindful way, or in a soulful way is maybe a better word, it really changes us. And that's the other aspect of my work that I mean, again, sometimes I can't see the forest for the trees, is having this holistic model, saying that the unconscious is as important as the conscious. So when the smell brings things up, that we need to honor that. It's not just what do I want it to do, which to me has a sort of ego ring. It's like, oh, this smell is good for this, or I'm going to use this smell like I have a cup of coffee, but to say, okay, I'm going to open myself to the experience. So having that holistic framework that there's all these parts of ourselves that are not subject to the ego, to the story we tell ourselves, and that those parts are just as important and bear important gifts for us. And the aromas are a way of accessing those gifts. It's both the aromas and sort of the holistic model of the psyche that to me offer the way forward.
I can see how those come together. It's fascinating. Well, I just want to thank you for your time. It's been such an exciting delight to spend time with you and talk with you again. So thank you. Is there anything that you wanted to say that we didn't get around to covering? Or did we do a pretty good job?
No, I think I've been very passionate and excited about everything we've talked about. The only thing I'll say is that if any of the listeners want to delve deeper, I wanted to mention my website, or our website, which
Oh,
is
please.
it's aromagnosis.com, which is AROMAGNOSIS.com, aromagnosis. And again, that's, we all know what the word aroma means. And gnosis is the old Greek word for direct understanding, direct perception. So we came up with that. So if people are interested, go to Aromagnosis. You can join our newsletter. There's all sorts of offerings. But I think if people are sort of a little hungry to go deeper, that's the next logical step.
We'll put it on the screen. We'll put your website on the screen. And then
Great.
I usually have a blog that goes with the podcast. I was thinking of putting your Unbecoming article in there. Is that okay?
By me, that's totally okay.
Okay.
I know I know that Matt in America likes to have exclusive content, but you said you have a close link with Bob, so I'm sure if he's okay with it, I'm totally okay with that, because I think I think well in conversation, but sometimes when I write things down, I can go into more detail than I can in conversation.
Okay, well, once again, thank you so much. And I hope our paths continue to cross.
I hope so too.
Blessings on your work.
Thank you. Thank you, Laurie.
Well, I told you that was going to be interesting, and it was. A lot of things to think about. A lot of things that may have pushed various buttons, which is, as we say, if your buttons get pushed, that's a clue to go within and see what's going on within ourselves as we look at our shadows and strengths and our areas that need some support. We all need to learn and keep learning and growing if we're going to get this better and get it right. So thanks so much for joining us. See you next time.